You are listening to Breaking the Waves, conversations about the Dutch pandemic. My name is Matt Cornell, and I started this podcast to provide information about the Dutch coronavirus strategy in the English language. So for people both inside the Netherlands and for people around the world who are interested in a critical analysis of Dutch coronavirus policy. Now, today's episode is a little bit different because we're going to look at the situation of Sweden, which, as many listeners may know, took a similar approach to the coronavirus as the Netherlands. My guest today is Andreia Rodrigues. Andreia was born and raised in Portugal, but moved to Sweden about 5 years ago after having completed her law degree. She was supposed to stay for just 1 year working with an NGO, but ended up living in Sweden for 4.5 years. She recently moved back to Portugal due to Sweden's failure to manage the pandemic. Andreia is one of the co-founders of the Save Sweden COVID-19 network, which opposes Sweden's approach to the pandemic and advocates for Sweden to follow the WHO and ECDC recommendations regarding COVID-19. Our conversation took place on Friday, April 30th of 2021.
So, Andreia, I want to thank you very much for speaking with me today on Breaking the Waves. And ordinarily, this podcast discusses coronavirus pandemic in the Netherlands. However, I've been following your work and your insights on Twitter for a better part of a year now about the situation in Sweden, which seems to be somewhat similar to what's happening in the Netherlands. Could you tell our listeners what is going on in Sweden?
Yeah, so you're very, very right about the similarities between what's going on in Sweden and the Netherlands. When I talked about that with people in the Netherlands, it was amazing to see how similar it was. And basically what is still going on now in Sweden is that they are still not taking the pandemic as seriously as other countries take it. So, for example, masks are still a taboo. They are still not required. They are recommended in some places, but people just don't even care so much about that. And other measures that are taken in other countries, like, for example, now because of the mutations, other countries are really going out of their way to find these cases of mutations. In Sweden, they don't really bother that much. They don't look so hard, they don't sequence so much. So, of course, they don't find it. So, but yeah, of course, a lot of things have gotten better with time also. In the beginning, it was terrible compared to what it is now. In the beginning, there was not even household quarantine or any of those things. So, yeah, so it has been some progress, but it's still really not good.
Could you tell me a little bit about your background and how you found yourself moving to Sweden?
Yeah, so I am born and raised in Portugal. And, I'm from the countryside here in Portugal. I was really looking forward to kind of moving to a big city and discovering the world. So first I moved to Sweden. First I moved to Lisbon, actually, and studied law. And then I moved to Sweden because I had this conception that Sweden was so good. And I was really hopeful. I was 22 and very naive. And I moved there to work with an organization. I was going to stay for 1 year, but then I met my now fiancé. So I ended up staying, the typical story. Going to stay 1 year, then I stayed almost 5. And when I was there, I started working in a preschool. I worked in several preschools also there in Stockholm. And then I couldn't take it anymore and I moved back. So now I'm here again in Portugal.
And did you relocate with your fiance?
No.
Oh, I'm sorry.
He's still there. I moved like in a emergency state of mind, like I couldn't take it anymore. So he's going to come later.
Let's talk about that. What were some of the reasons that you couldn't take it anymore where you said, I need to get out of here?
There were many reasons throughout the whole year, because like I said, I worked in a preschool throughout the whole 2020. So you can imagine how it is to work in a preschool in a country that doesn't take the pandemic seriously, and in a country where the experts and the public health agency claim that kids don't transmit the virus, masks don't work, all of this. So I basically got drained at my work. I couldn't wear a mask.
As in your boss told you can't wear a mask.
No, that is the tricky part, that it's not so easy to explain, but there was not even a conversation about masks at my work.
Okay.
It was such a taboo. When I quit my job, in the day I quit my job, I went to my boss and said, I cannot take this anymore. Today, the municipality sent a theater to our preschool. They sent strangers to my workplace. They were not wearing masks. I cannot wear masks. This is unbearable for me. She didn't turn to me and say, oh, but you can wear a mask if you want. No, she didn't say that. She said, oh, yes, I understand.
I think I understand this. It's very similar in the Netherlands, where there's a lot of unspoken social pressure and institutional pressure to do what everyone else is doing.
Yes.
And if you wear a mask, I was talking about this with Mick Block, who's a containment activist here. If you wear a mask, it's almost like you're reminding people that we're all behaving irrationally and that we're ignoring a pandemic. So you can actually cause quite some backlash.
Yes, exactly.
And I've heard that stories about pretty violent responses to people wearing masks in Sweden. Can you tell us about that?
Yeah, that happened to me as well, and some of my friends, because all kinds of things happened to me. For example, when I was at the grocery store, which was basically the only public place I was other than work, I had so many people point at me and laugh and scream, oh, are you so scared of corona? Then you should stay at home. Oh, didn't you hear that Tegnell says masks don't work? You look ridiculous with that mask. Which really shocked me, in a supposed to be civilized country with so civilized people. I never imagined this would happen, but it did happen. And also when we were protesting, I even had people spit at me and my friend. They did that to me and my friends. And they also screamed and shouted, and they were really, you could see that it triggered them in a way.
So let's talk a little bit more about the preschool. So you said that they brought a theater troupe or performers during a pandemic to entertain the children. Were there, while you were working there, were there any infections or outbreaks among teachers or staff? Okay.
There was, that we know of. That's also something worth saying, that throughout the whole first wave, there was no testing in Sweden. Like no testing, unless you needed to be hospitalized. But if you got symptoms and you tried to get the test, it was impossible. So, of course, we didn't have any official cases throughout the first wave, even though I am quite convinced that we did have a huge outbreak, actually, because at one point, 50% of all the people in the preschool were home with symptoms like fever, throat pain, and all that. Both kids and staff. So it could have been something else. Of course, when you work with kids, it's like that. But in this case, it was really a lot of people. So, but in the second wave, when there was already there was possibilities of getting tested, there was one case, one confirmed case. But the thing is that because it's Sweden, there was no precautions, if you know what I mean. We knew that he was infected, but there was no extra cleaning of the school. There was no testing of us who were close contacts to him. There was no information to the parents, except from me and my colleagues in a clandestine way, going, and telling the parents, some of them. So it could have been more than one case, but it was not detected. It was just that one case officially.
Now, you mentioned that you and your friends were protesting Corona policy. Could you tell me a little bit about how you became an activist and a little bit about the organization that you started?
Yeah. So the thing is that in the beginning, in the very beginning, like in March of 2020, it was so frustrating to see that nothing was happening. While other countries like my own were taking so much precautions and measures, really going out of their way to prevent this from happening, we were seeing that Sweden was really not interested. So I got so frustrated, and I felt very alone also, like an outsider. I could feel that people were not worrying about this. They were really happy, actually, that Tegnell said this was nothing to worry about. That is exactly what they wanted to hear.
Yeah, I mean, and we saw these things in the media about people getting tattoos of Anders Tegnell, like this weird cult-like sort of worship of the epidemiologist. This is very strange.
Yes. Yeah. It's very frightening, to see that, like, he is not even elected and he got all this. It was very weird to see that, actually. People were so sensitive about that. You couldn't say anything bad about him. If you criticized him openly, it was very bad. Anyway, when I realized all of that, I felt the need to find people who were concerned like me. And I didn't know what to do exactly, but I felt I needed to do something at least. So I found some like-minded people, and we started our group called Save Sweden COVID-19. And we are all just regular people. People think that we are paid by the Russians or the Chinese or whatever, but we are really just regular people who didn't know what else to do. And we just really wanted to say to the world, look, there are people in Sweden who are not satisfied with this. There are protests, even if they are small. This is going to stay for history, even if we were very few, in protests. So we decided to just do several things. One of them was just go out to the streets and protest, stand there with our signs and masks, just to remind people that really there is something happening here. And we also, of course, talked to journalists abroad, because we wanted the world to know what we were seeing in reality, because it's not always, that doesn't always come true. Right. What we see in reality in our daily lives.
How many of the people in your organization are also Swedish?
In the beginning, there was not a lot of Swedish people, I can tell you, because I guess they were kind of scared. Many people didn't want to take action, because back then it was very much a doubt, right? Tegnell sounded very sure. We're going to have herd immunity. Now he denies it all. But if you see what he said in the very beginning, he was quite open about this herd immunity theory he had. We're going to have herd immunity before we have vaccine. Sweden is the only one that's doing it right. All of this. So people were kind of scared, I noticed, of admitting they didn't agree with him, because what if he is right? So it's better I wait and see. If he's wrong, then I can join the group or something. So in the beginning, it was just the expats, loud South Europeans just making noise. And then some Swedes started joining. And I would say now it's like 50% experts, but 50% Swedes, maybe something like that.
You mentioned this whole herd immunity idea. Also, our Prime Minister here in the Netherlands, Mark Rutte, announced a similar policy. And then, of course, as you know, this was just a couple of days after Boris Johnson had announced a similar policy. And then once the imperial college study came out that said how many people would have to die and get sick as a result of that policy. There was a huge backlash in the British press, and so the Boris Johnson, apparently anyways, backed away. Meanwhile, the Netherlands went full speed ahead. However, there was a little bit of criticism, and so Rutte decided here to kind of change message a little bit, and he said, well, the herd immunity is not the goal. It is a byproduct, or it's a consequence. Did Tegnell make a similar kind of move to sort of reframe it?
Yes, it was exactly that argument that you said now, like an excuse. First, they were quite open about wanting it. You know, they said it's no point doing anything because herd immunity is the only thing that's going to stop this. But when the UK, like you said, changed their strategy a bit, then Tegnell and the whole public health agency started being a bit more careful in the way that they talked about herd immunity. They started saying exactly that, what you said now. It's not our strategy. It's just the consequence of, consequence of not doing anything, basically.
Yeah, I saw an interview with Johan Giesecke, I think his name is, who is the Swedish scientist who probably inspired the policy that Sweden decided to follow. And he was really under the impression, and he was being interviewed now recently, like a year after all of this had happened. And he admitted that he had thought that this would only take a couple of months. Mm-hmm. So they really, according to their own calculations, we were all going to be back, back in nightclubs and restaurants by May if you just let the virus run wild. And that turned out to be wrong.
Giesecke, actually, he calls the people at the public health agency in Sweden my boys at FHM, which is the, FHM is Folkhälsomyndigheten, the agency. So my boys,
it's not the clothing retailer.
No.
Okay.
No, it's like he calls them my boys. He is like their mentor. He has worked as a consult at the agency, and I'm quite sure he is there again, working with them. So it's no secret that he has influenced the strategy, and he tried to influence a lot of other countries also. He tried to influence Ireland. They basically laughed at him. They were on a world tour, both of them, Tegnell and Giesecke, just branding the Swedish model, the Swedish strategy. And look, do like us, because we are not even seeing any outbreaks in school, and our schools never closed, and we don't even wear masks, so it's fine. Yeah, I mean, there was no outbreaks because, like I said before, there was no testing in the first wave. So, of course, you're not going to find anything. But basically Giesecke, even he's quite open, much more open than Tegnell, I would say. He just said it straight out. And in the beginning, he said that the pandemic was a self-inflicted problem, a self-inflicted crisis, because he said like this: if the world would just let it happen, this would all be over by now, and we wouldn't even have seen so many deaths from it. It wouldn't be catastrophe. So this was his theory. And of course, we know that's not true, because we have seen in Manaus in Brazil, for example, they thought they had herd immunity, then they had a huge outbreak. And in Sweden, it didn't work either. They basically let it spread, and now look what's happening.
Yeah, correct me if I'm wrong, but right now Sweden has the highest daily case rate in Europe per capita, right? So, in fact, is undergoing a huge wave. Now, do we know, or do you know from your sources in Sweden, whether those are new, original, like first-time infections, or whether those are infections with a new variant, or do we know yet?
Many people that I know who have tested positive recently, they had already had it.
Okay, so this could very likely be the UK variant or the Brazilian variant. Okay.
Yeah.
Has this changed at all the official position? Like, because they were betting on, first of all, it all being over in 2 months, and then they were betting on no damage to the economy. It looks like the Swedish economy didn't do so well, and then they were also saying, well, everyone will have immunity. So, have they changed now that they're seeing reinfections and that they're seeing this high case rate? Have they changed any of their approach?
A bit, but it seems to me that they are just so stubborn in not wanting to take measures. So it seems that they don't really care about the price. They are just, they cannot deny anymore that people can get reinfected, right?
Right.
They were saying first that once you had it, and that's it, you have immunity. Actually, at one point, the Public Health Agency gave people the advice that you don't need to worry if you had it. Even if you test your blood and you don't have antibodies, you have immunity. So imagine this. They were really confident that once you had it, that's it. You're not going to have it anymore. So now they cannot actually deny that it's not like that, because we are seeing people are getting reinfected and all that. So they don't really talk so much about that anymore. They don't treat immunity through natural infection as a holy grail anymore. But the fact is that they still don't go out of their way to prevent huge spread like we are seeing now.
How did your experience in Sweden affect you socially in terms of your relationships, your friendships? What did it do to your feelings about being a part of Swedish society?
It basically broke me in so many ways, Actually, I noticed that now. I noticed before also, but I noticed that it has affected me and others so much, because I felt basically like I was living in a nightmare. Like people have said, it really felt like an experiment that I was forced to take part of, because I worked also in the preschool. Of course, if I had a job that I could do from home, I didn't have to take the bus every day and all that, I probably would have felt a bit more at ease, but I didn't feel like that. Plus, my fiancé works at the airport, so you can see how exposed we were. Yeah. So I just basically felt that I was traumatized, and I still feel like that. I feel traumatized about Sweden and the Swedish society, kind of,
Yeah. Could you talk a little bit? We didn't talk about this yet. Can you talk a little bit about what happened? So you said most people were not able to get tested. So of course the Swedish numbers, especially from the first wave, are probably wrong, right? Well, it's a similar case in the Netherlands. You could only get tested if you were being admitted to hospital. Mm. So we can only really tell how many died through looking at the excess death statistics. How many people do we think died in Sweden, and who died?
Basically, a lot of people died in elderly care homes. Because also something that's very important to say, I believe many people still don't believe this, but it is true that in the first wave, you had guidelines like masks are useless and even bad and dangerous. Yep. Not even in elderly care, they were recommended even. I'm not even saying mandatory. They were not even recommended. So people were working with the elderly without masks.
Same here. Yeah.
There was no household quarantine. So if I worked in an elderly care home and my fiancé was going to the airport every day and having contact with how many people, I would and even if he got sick with all the symptoms of COVID-19, wouldn't get tested because there was no testing, I would still need to go to my job and take care of the elderly. So these were the conditions, and somehow they were still hoping, or, I don't know, expecting, but it's really stupid to expect that. But how could it not come in to the elderly care? How? Of course, it was just a matter of time. And so many people got infected there. And in order not to pressure the healthcare system too much, basically at one point, they stopped being admitted to hospitals. They got palliative care instead, the elderly. They couldn't get oxygen either in the elderly care homes because they didn't have oxygen there. There was also some guidelines about them not being able to give that in elderly care homes, but there was no space in hospitals. So basically they didn't get oxygen or other treatments anywhere. And then they came with that excuse of, but they are so old and they are about to die, so they wouldn't even survive being in intensive care. It would be so cruel to them to put them in an incubator. They almost treat it like it's something so good that we are doing to them, just letting them die in the elderly care.
Right. And this is very similar to what happened in the Netherlands, where elderly people were denied care and not only left to die with just some morphine, but they were also, as you said, not given oxygen, which means that they suffocated to death. I mean, this is not a disease that you would want to die with without oxygen.
Yes.
So it sounds very similar to what happened here. Had a similar set of priorities. They also, I don't know how often this was implemented, but in the Netherlands, they drew up guidelines also for people with disabilities. When they would have to deny care, and I know even this go round they have included like people who are extremely overweight or something like that. So they have all of these. They have all of these protocols that they might bring in the event that they have to choose who gets a bed.
Yes.
Yeah.
In Sweden, it was the same.
Yeah.
They took that and they came up with those guidelines before they ever took measures to reduce the spread. They were willing to do that, to just basically deny those people healthcare before they were willing to close stores, restaurants, and all that, which they basically never done. Even to this day, they never done that.
And plenty of people in Sweden who go to stores, movie theaters, bars without masks.
Yes.
Even now with 10,000 cases a day.
Yes. It's unbelievable. I mean, I can honestly say that even being here now in Portugal, I came in the beginning of March. I've been here basically 2 months now, and it's still such a surprise for me when I go into a store and everyone is wearing a mask, because I was so used to being the only one wearing a mask.
What else was that like? Tell me about, so you said you lived in Sweden for about 4 years, right?
Yeah.
When you finally made the decision to leave, you said you felt quite a bit of pressure to do so. What was it like to come home?
It was such a blessing. I cried so much. I cried on the way home. I mean, as soon as the plane took off, I was crying. I cried in Amsterdam when I had to stop to change plane. And then I cried when I landed on Portuguese soil. I mean, I was totally broken. I am still broken. But it feels like I have landed in paradise, because many people throw to my face that, Portugal had even more deaths than Sweden, which is true. I mean, I'm not quite sure it's true, because there was always testing in Portugal, even throughout the first wave. So I believe the Portuguese numbers are much more accurate than the Swedish ones. But if we just consider the official deaths, yes, we have more deaths than Sweden. But being here in Portugal, I have this overwhelming feeling that if something bad happens again, the government is going to take action. People are going to be careful. The municipalities are going to go out of their way to do something. And in Sweden, it's not like that. It was basically a feeling that whatever might come, they will never do what they need to do, because they seem to have this stubborn ideology almost of being the only ones in the world that are going to have total freedom, even though there's a pandemic.
But of course, death is only one part of that equation too, right? If I don't know what the latest numbers are on the number of Swedish people who may have already been infected, but conservatively, something like 10% of those who did get infected are likely to suffer from long COVID. Mm-hmm. So a country that says, oh, hey, our deaths are lower than this other country. Yeah, but you might have much higher rates of long-term disability from long COVID. Yeah. Do you know now what the estimates are? How many people have been infected in Sweden?
Not at all. Everyone can guess, but
yeah,
I think that it's way above any guess that we might have. Yeah. Considering what I saw in the first wave, you know what I mean? There was no precautions at all. Nothing at all. So I can only imagine that the numbers are huge. How many people got infected?
I remember one of the things that was always being sold in the international press about Sweden, and of course there was a lot of discourse that's aged very badly about the Swedish Miracle that came out over the summer of last year, where they talked a lot about how, well, Sweden is different because something like 40% of people live alone. So you don't have these like multi-generational households like you have in Italy, for instance. So there's just less opportunities for people to infect each other because of population density. And then, all this stuff about how much better the healthcare system is, for instance.
Not true, but yeah, but they said that.
Yeah. Can you talk a little bit about what the international press there? Because I remember arguing with a few journalists about this who were, actually one Guardian journalist in particular who was really pushing this narrative of well, maybe Sweden's onto something. Mm-hmm. And we just have to wait till the end and find out.
Yeah, there was a lot of this, of course. And even Tegnell was dragging so much, like I said, that he was really convinced that Sweden is not going to even have a second wave. He said this with all the words, but like you said, this with the households, 40% of people live alone. Can you imagine what a missed opportunity that is? Sweden is one of the countries in the whole world that had the most advantages that they could have taken advantage of. Like Norway did, like Finland did, and had amazing results. They didn't, so that says a lot. I have read a lot of things about, like you said now, Sweden might be onto something. Is Sweden the only adult in the room and all of this? But come on, how can this even be an argument? This is a huge risk to take. There was no proof that they would be right. We didn't know much about this virus in the beginning. So they basically just gambled. And we are seeing now the results of that.
My understanding, too, is that they must have known they were doing something wrong, or at least potentially wrong, because there was an investigative piece, like you might remember where it came from. There was an investigative article about the Swedish policy. And one of the things they found out was that there were no notes. There was no documentation whatsoever of conversations between the Prime Minister and Tegnell. Can you talk about this? This was very, I can't remember all the details, but.
Yeah, this is very shady. There are no notes. And Tegnell has deleted many, many emails. And he claims it's because there was problems with space or something. So he needs to delete
that. To clear up his hard drive.
So conveniently, he deleted a lot of emails that might have been of interest for investigating this whole thing. And some of the emails that he deleted were some of the biggest bombshells. That it's like a huge proof what he was doing. And we know now that because the person to which he sent the email still had it. So we got it. So that's extremely shady that he's been going around and deleting such important emails. And yeah, I mean, it's totally obvious that they knew they were doing something wrong. Of course, otherwise they would have been much more open. They have still, as you might know, you might have seen that on Twitter, that now Lena Hallengren, the social minister of health, she is saying that there was no strategy. So,
No,
I mean,
no strategy at all.
It's like they've been saying for 1 year, the Swedish strategy is the best one in the world. Everyone else is doing it wrong. We just have a different strategy because we have a different culture. All of this about the strategy. Now she comes and says there's no strategy. So, I mean, come on. Anyone can see they are just trying to save face.
What about the neighboring countries? So, for instance, I know that Norway, Denmark, these countries did much better at controlling the pandemic, have very low death rates and infection rates. Was there an effort to keep people from Sweden coming into those countries?
Yes, absolutely. For example, Norway closed the borders. So Norway has a huge border with Sweden, of course. So they closed it, and then Sweden responded by closing it also, of course. And they put the military there, even though Norway was no danger towards Sweden because their numbers were ridiculously low compared to Swedish numbers. But and there was times also that Norway didn't allow Swedish travelers to come in without, respecting these restrictions, like having a negative test and all of this. So this is something that has hurt a lot of Swedish people's egos because of this Nordic, Scandinavian, companionship they have. They're like brothers, and now it's like a betrayal. But of course, it's completely understandable. If you see the numbers now, and Norway side by side with Sweden, it's unbelievable. I don't know still to this day how Norway managed and is still managing to keep a disaster from happening when they have such a huge border with Sweden. And Sweden is having the highest amount of spread right now, and Norway is doing so well compared.
Yeah, I don't know what it would be like if you cross a land border, but like I spoke with Amrish Baiju yesterday, he's an epidemiologist in Norway, and he said that if you fly in, you have to stay in a COVID hotel, or like a quarantine hotel, where I think it's something like €50 a day. And you have to wait until you've, a certain amount of time before you're able to come out of quarantine. Mm-hmm. So I think that they are very careful about the virus there. He also said that the public messaging there is very much about involving everyone in the fight against the pandemic. It's very different from what you and I are used to, where the messaging is very individualistic. It's very, wash your hands, stay home if you have symptoms, all of these kinds of things, but a relatively open society where if you step outside your door, you're taking a lot of risks that you wouldn't in a country where there are a lot more protections.
Yeah, that's what also I've been noticing here in Portugal now. Here, I feel that I am sharing this burden with 10 million people.
Yeah.
In Sweden, I was feeling that I was carrying the burden on my shoulders because I was the only one wearing a mask in the whole bus. I was the only one wearing a mask at the supermarket and such things. So, and of course, my mask is not going to protect me if I'm in the same store as like 500 other people who are not wearing their masks. Of course, it protects me more than not having anything. But you know what I mean? It was a huge tsunami coming at me constantly.
Yeah.
So the messaging here is also totally different in Portugal. We are going to unite and fight the virus. We are going to do everything possible to fight the virus. While in Sweden and the Netherlands, it's more like every man for themselves. And actually, if you care too much about the virus, you're pathetic.
Yeah,
then people are going to make fun of you instead.
in terms of that individual, like that focus on individuals and individual responsibility, I remember reading that in Sweden, migrants were disproportionately affected. And I'm wondering if you can talk about that, and also about how the media responded to this, or how politicians responded to this.
That was one of the things that hurt me the most, because I could see with my own eyes how they were in such a disadvantage, every single day. Because I lived in an area that was quite close to some of the most affected areas in Stockholm, where most people died and all that. So I used to take the bus with these people. There were many people from Somalia, many from Syria, many that I also knew. And of course, they had to take the same bus as I took, with maskless people at 6 a.m. And they had to go to a job where they didn't have any protections. And they couldn't have home delivery of groceries because they didn't have enough money for that. They had to go to the cheapest stores where there was tons of people without a mask or without caring about social distance or anything. So, of course, they got affected more, obviously. And they also lived in small apartments with their father and mother and grandma and all of this. So, it's no surprise they got more affected. But politicians and the media and so many regular people also, they basically said, oh, yes, because they don't speak proper Swedish, so they don't understand the guidelines.
Okay, but why wouldn't they publish the guidelines in the native languages of those immigrants?
Yes, they didn't do that in the beginning. It took quite a while until they did that. And they basically said that it was a mistake. They basically didn't think of that, or they were not fast enough. But I personally think that's all BS, because these people were following the guidelines, and that was the problem. You know what I mean? Because they were following the guidelines of not wearing a mask. They were following the guidelines of working even if their family members had COVID. So, these were the guidelines.
I'm sorry. So in Sweden, you could go to work if your family member was sick with COVID.
Yes.
You wouldn't have to get a test first.
No. And you know why? Because the Public Health Agency claimed that there was no such thing as pre-symptomatic or asymptomatic spread of COVID. So if you don't feel symptoms, even if your whole family is at home having COVID, if you feel fine, then there's no way you can pass it on to anyone else.
Yeah, it's the same here, actually. In the Netherlands, I went to my GP. She was not wearing a mask, and I asked her to put on a mask, and she said that COVID was not contagious without symptoms. And that was in September of last year, right? So very, very, very late in the game, which I think we knew about this by March of last year. Mm-hmm. What do you think? You lived in Sweden for a few years, and you're an outsider, as you said. Why do you think Swedish people mostly went along with this policy?
They have very individualistic lives where they are independent. They don't need to take care of anyone else, and they don't expect anyone else to also do things for them and take care of them. So when something like this comes along, and you really have to share a burden with your whole country, and every single thing you do might impact someone else's life, they were not prepared for that. They don't have that kind of culture. If you ask a Swedish person to stay one evening at home to save someone else's life, they will think that's pathetic. Why should I waste my evening so that you don't die?
This is strange to me, just because I grew up in the United States, where we had this idea of Scandinavian social democracies as countries that had very strong welfare states. So they had a very a strong social safety net. And I always assumed that meant also that they were highly collectivist kinds of societies, but they actually turned out to be, in some cases, very individualistic, it sounds like.
Yeah, I had the same expectation before I moved there. And even when I was already living there, because it's very easy to be mistaken about that. Because you see that the Swedish people always wait in line. They always respect all the rules. They are so respectful in that way, with everything. You don't see a Swedish person, almost never I've seen that, throwing something at, looting, just throwing something to the ground. So basically they are very good at that, but that is because it's on paper. You know what I mean? They know that they are expected, of doing that. So, but they don't go out of their way voluntarily to make your life easier. They basically think of their own well-being.
What is the work of Save Sweden now? Save Sweden COVID-19 now? Is the group still active? And what part are you playing now from your much more comfortable place in Portugal?
Yeah, so basically we are very different now because we are not protesting now. Also because I'm here and, we have basically done our part, we feel, in the protesting front. Yeah. Also, the spread is huge now, so it wouldn't be responsible to even outdoors have protests. So basically, we are just, we are analyzing what's happening and trying to put it out there, especially in English, because in the beginning, there was a lot of interest about Sweden, a lot of articles about the Swedish way and la la la. Now there doesn't seem to be a lot of interest, not as in the beginning, because now it's not going well, right? So now it's not so interesting. But we still want people to know what's going on in Sweden. And for that, it's useful to post in English and tweet in English so that people can realize so I'm not there anymore, but what we are seeing in our daily lives. And also we have different goals like other groups. I don't know if you heard about Migrants, that group that was chased down by Sweden's radio, and we were accused of being, that's a whole another story. But I'm also part of that group. And, there's a lot of overlap. People who are in Save Sweden, they are also on Migrants and other groups. And for example, on Migrants, we want to bring people to accountability. We want to sue them, basically. And that's, of course, going to take a lot of time. But that's also something that we are working on. And Save Sweden also, that's not the point of Save Sweden to sue them. But we, of course, have a lot of material which is very important in documenting what they have been saying. The leaked emails, not really leaked because it's public, but, basically to have a record of all the things they have been doing.
Is there a place that our listeners could find more on the web or on Twitter?
Yeah, Save Sweden is on Twitter. It's called Save Sweden COVID-19.
I hope that also, if the goal now is to get more English language and international attention, I hope that our conversation can be useful for that as well. Andreia, I want to thank you very much for the work that you did and are doing for Save Sweden COVID-19 and also for talking with me today.
Thank you so much.
That concludes my interview with Andreia Rodrigues. The interview was recorded on April 30th of this year, 2021. If you have feedback or if you have ideas about guests that I should interview in future episodes, please don't hesitate to reach out. Thanks once again to Andreia. And thank you for listening to Breaking the Waves, conversations about the Dutch pandemic.